Going to give everyone a chance to join the room. So just a few moments before we kick off here. And for those that are just joining, good afternoon. We're giving everyone just a few moments to join us. Okay, I think we are good to kick off here. Good afternoon, all. Welcome to our first cross peer learning collaborative and intensive TA states webinar using marketing campaigns to expand and advance the direct care workforce, the WisCaregiver careers experience. So I'm Stephanie Gibbs, Director of the Direct Care Workforce Strategy Center. To offer a visual description of myself in this virtual environment, I'm a woman with brown hair that's long. I have on glasses. I'm wearing a white blazer and I have on a printed top and a necklace that's brown. So it's so wonderful to have all of our PLC and ITA states together for joint learning. We are actively exploring and addressing some of the key themes emerging across PLC and ITA states. So many states have mentioned marketing and messaging as a priority, and just as many states have mentioned the success of Wisconsin's experience as an interest. So today we are so excited to learn about Wisconsin's successful marketing campaign to attract new direct care professionals and caregivers into the field. We are grateful that Kevin Coughlin from Wisconsin's Department of Health Services and Susan and Hans Pigorsch from Pigorsch Media Design are with us this afternoon to share their work. So with that, I'm going to turn the session over to Jordana Davis from the Rocking Stone Group. Rocking Stone has been leading the facilitation of our peer learning collaboratives, and Jordana is going to lead us through today's session. So Jordana, over to you.
Thank you so much, Stephanie. And thank you to all the Peer Learning Collaborative and Intensive TA states for joining us today. As Stephanie said, my name is Jordana Davis. I'm the president of the Rocking Stone Group. And as many of you know, we facilitate the Peer Learning Collaboratives. As a visual description, I'm a white woman in my 40s with brown eyes and brown hair. I'm wearing black rimmed glasses and a gray dress and a cream blazer. I am thrilled to be hosting what I know will be a fascinating conversation this afternoon. Let's start with a quick roadmap for today's session. In a minute, I'll turn it over to our outstanding presenters to share their work. Make sure you've got your volume turned up for that, since they'll be sharing a number of the videos that were part of the campaign. Then we'll go into a moderated discussion where I'll ask our Wisconsin team a few questions, and then we'll open our session to an audience Q&A. Some quick logistics. As attendees, you'll all be muted for the session. Please submit your questions for the presenters at any time through the Q&A function at the bottom of the screen. Please use the chat for any technical problems you need addressed, and we will do our best to be of assistance. With logistics out of the way, I'd like to introduce our presenters. Kevin, we'll start with you. Kevin Coughlin has spent the last 30 years in the private and public sector working in the assisted living field as an operator, a regulator, and a public funder. Kevin currently is a Policy Initiatives Advisor Executive in the Wisconsin Division of Medicaid Services. He's been a speaker at numerous state and national conferences presenting on the subjects of workforce, assisted living regulatory reform, and long-term care quality improvement. In 2007, Kevin was the recipient of the Public Official of the Year Award by Governing Magazine for collaborating with key partners and reforming Wisconsin's assisted living regulatory process by rewarding assisted living communities striving for excellence. Next, we're so happy to be joined by Susan and Hans Pigorsch of Pigorsch Media Design. Some of you may recognize them also as subject matter experts to your states. The Pigorsch Media Design team creates and produces media and cohesive messaging that achieves their clients' goals. Their approach is to fully invest in understanding their clients' marketplace and then strategically empowering their clients' brands. Their clients include government agencies, institutions of higher education, and private corporations. Susan and Hans are proud to call Madison, Wisconsin home. They are native Wisconsinites who've worked across the country with executive leaders and communication professionals. Their roots are in journalism, communication, and advertising, design, and production. Pigorsch Media Design started developing the WisCaregiver Careers brand with Kevin in 2017. Thanks so much to all three of you for being here today and for sharing your work with this audience. The floor is yours.
All right, thank you very much, Jordana. Kevin Coughlin here. I'm a 60-ish-year-old white man with glasses, and I'm wearing a white button-down and blue blazer. And I'm really honored here to be with you today. Next slide, please. And again, with me today is Hans and Susan Pigorsch. So here's our some of our information, and you'll have access to this webinar as well. Next slide, please. So I've been a public servant with our Department of Health Services for 27 years. And one lesson I learned over that time is that state agencies do not do website design, marketing, and consumer analysis very well. We do websites and social media and communication for advocates, our participants, providers, and our collaborators really well. But for the people that are looking to become direct care workers, we don't do that. They don't follow us on our social media channels. They don't come to our website. So back in 2017, we had funding available to address the workforce crisis of CNAs in our Wisconsin nursing homes. One of the best decisions we made at that time was to include a marketing budget and to go outside our state agency to find a media company that could do this work. And that's when we contracted with Pigorsch Media. And since then, they've been our marketing partners for 4 different versions of WisCaregiver Careers with 7 different funding sources. One of our important messages that we want to communicate today is building a brand and infrastructure that features benefits and your secret sauce to give flexibility and resources that you can leverage later. So this is our house of brands, WisCaregiver Careers. So we really have 3 brands that are interconnected and complementary. As indicated back in 2017, we started with WisCaregiver CNA to support our CNA crisis in nursing homes. Then in 2021, the caregiver crisis was really hitting our home and community-based services, and we knew we had to do something. Every meeting that I went to, advocates, providers, they were all saying we do not have the staff to take care of these individuals. And Wisconsin, for our home and community-based services, we have over 80,000 people that depend on a caregiver. So when we had Money Follows the Person supplement come along, and then later American Rescue Plan Act, we created a multi-pronged approach to addressing this issue. We learned a lot from participating in the 2021 CMS Workforce Collaborative. We did listening sessions, including caregivers. And then we also did extensive research and learned a lot from PHI as well. We already had a strong brand presence with WisCaregiver CNA, and we knew that we could leverage all of this that we created with a new certified direct care professional program. We kept the secret sauce that we knew was effective with CNA, and then we also since then have created WisCaregiver Career, really an umbrella that includes both our CNA and CDCP. Next. So today, the rest of the time, and you're going to hear mostly from Susan and Hans, and they are the really have brought the great genius around our marketing and our branding to place. So we'll be talking about our certified direct care professional. Next. So we'd like to start with a short video that really describes the full breadth of our program. And also you'll see it incorporates much of our department leadership and university leadership into the project, which I think helped our program really launch and be successful. So next. Next slide for the video.
WisCaregiver Careers, a free certification program to increase the number of caregivers in our state.
Direct care workforce professionals are so important in our state because they are the backbone of what is supporting our home and community-based system.
So if you need support with regular activities of daily living, if you need support with cooking, if you need support with bathing, these are things that we can bring to you in your home with the support of direct care professionals.
80% of the individuals now live in the community versus in an institutional setting. We are one of the few states in the nation that has accomplished that goal. It is a much more cost-effective option for people. It's what people want in the future.
The demand for this workforce has ballooned in the last few years, and it will continue to surge in the decade ahead. We estimate that between 2020 and 2030, the long-term care sector nationally will need to fill about 7.9 million job openings in direct care.
WisCaregiver Careers really benefits the people of Wisconsin. Direct care professionals do so much to support the health and well-being of people all over the state so that they can live as independently as possible in their home or in a community-based setting for as long as possible.
Wisconsin's program is easily one of the best in the country because of a few reasons. One is that it's building on a really successful training and recruitment model. It's really a building block towards the ultimate goal, which is making sure that direct care jobs are a true profession that are respected as much as any other healthcare role.
The Wisconsin Department of Health Services has partnered with the University of Wisconsin at Green Bay to create a direct care professional certification program. And so this program will help provide training in a set of 14 discrete skill areas that a direct care professional needs in order to take care of someone in their home or in a community setting.
We know that by being able to provide this online, we can reach the population of the state and help to make a bigger impact on the problem we're trying to solve. Everyone deserves that comfort to know that the person that they are hiring has the proper training and expertise before they do the job. We want to make sure that everyone has the most up-to-date knowledge and credential to be able to make sure that they're providing the best care possible.
It's our goal to be able to train and certify over 10,000 direct care professionals across the state. You have the opportunity to take the training for free, to receive a $500 bonus as you are hired into your first job.
But what we're also doing is linking that training to other certifications such as Certified Nursing Assistant.
For the future of work, it is really important for people to be able to have recognized credentials that they can use to help advance their careers. Credentialing is really important to allow people to be able to create their own career pathways.
We believe these certifications will show that this workforce is worth an investment that is greater than the one that is being made now. It will attract more people to the work, and that will sustain these community services that Wisconsin has led the way in creating since the 70s.
I think the training programs ensure that workers have the knowledge, the skills, and the confidence to succeed in their roles. And I think the combination of those factors is cutting edge, and it's among the top in the country.
WisCaregiver Careers is a professional workforce advancement program of the Wisconsin Department of Health Services in partnership with the University of Wisconsin, Green Bay. Visit our website at wiscaregivercdcp.com.
So I'm going to send this over to Hans and Susan. Thanks.
Thank you, Kevin. I am Hans Pigorsch. I am a 60-ish-year-old male. I'm wearing a plaid shirt. I have glasses and kind of shortish gray hair. And I'm 6'6" tall. You would not know that via web.
And I'm Susan Pigorsch, not as tall as my partner to my left. I'm a middle-aged woman with shoulder length, brownish brown hair. I have a ivory blouse on with a small pattern and glasses. I'm glad to see you all.
Well, let's get started on our story. We're really, really excited to be here and proud to be helping Kevin with advancing all of his agendas and with all the WisCaregiver brands. So WisCaregivers is really made up of two main components. And those components are brand building. That's establishing the what, the why, the identity, and the messaging behind a brand. That's what we want the public to come to know WisCaregivers as. And then the advertising campaign. The advertising campaign is taking those brand elements, that message, the brand voice, the brand identity, and presenting it to the public in a variety of different mediums based upon strategic selections to connect with audiences. Every brand should have a purpose, and ours certainly does. We want to make a lasting impression that resonates with the public about what WisCaregivers is when they hear it in whatever media or see it in whatever media. We want them to have an understanding of what WisCaregiver Careers is about. And the main mission is to address the critical caregiver shortage by recruiting caring individuals into the healthcare field. Sounds easy. It's a little tricky. And to find people who have this compassion to help, who make the best caregivers. We want to present the concept of caregiving as a meaningful career. That's a big underlying message and purpose for this brand. We want to reframe and elevate the role of professional caregiving within the healthcare field and society. We want to make this an appealing career choice for individuals who are wanting to have a compassionate, meaningful career. We want to utilize and build a platform that utilizes a multi-language approach to engage diverse cultures. We didn't launch WisCaregiver Careers from the start in multiple languages, but we built a platform and a system that would allow us to migrate it to different languages. Brand goal is the essence of what a brand stands for, what it seeks to deliver and consistently reinforce in all of its advertising, all of its messaging. And ours is pretty simple. We want to appeal to caring individuals of all ages to start their healthcare career for free as a certified direct care professional. And that is the very short elevator speech for WisCaregiver Careers CDCP. We have a number of brand appeals that we want people to conjure when they think of WisCaregiver Careers or when they're first discovering WisCaregiver Careers. We want to showcase the flexibility and stability of a career in healthcare. We want to demonstrate that WisCaregiver Careers has benefits and rewards like free training, a $500 bonus. We wanted to highlight the rewards of a meaningful job that helps people in every way. And that meaningfulness can come in a number of different ways, from the satisfaction of helping individuals who need help to having flexibility in a caregiver's own lifestyle to work when they want to work, how they work. We want to emphasize the pride people feel when they see their names on Wisconsin's CDCP registry. This is we've found with our main target demographic that this is something that is very appealing to have earned something where they are recognized by the state of Wisconsin and they're on a registry. We want to feature the additional credentials that CDCPs will gain while advancing their careers. If you hear us use the term micro credentials, that's what we're talking about. So once they become a CDCP and have their certification, they have opportunities to add to that through these additional credentials. So every brand has a target audience, and Susan's going to tell you all about it.
Well, we're very lucky to have Kevin leading this initiative and his team, because we were not experts in caregiving in the state of Wisconsin. As he mentioned, we started with the Certified Nurse Aide program in 2017, but not this new concept of a certified direct care professional. So we got help understanding who our potential target audiences could be, and the vision is as big as the state, starting with all individuals who are interested in entering or advancing into the field of healthcare. Anyone who has ever considered a career in healthcare is part of our target audiences. And we know that we can start very early. This has been a new focus of our campaign to look at students who are looking for experience to start a career in healthcare. We're looking even at high school students and educators to get young people to consider become a CDCP before you move on to something else that you think you might want to do in healthcare. Could that be you want to be a nurse or a doctor or an administrator? You can begin now as a CDCP and get your first step. But we also know that there's a target audience of mid-career workers who are motivated by the possibility of giving back to their communities. We had an interview with a farm woman just in July who heard about WisCaregiver careers on the school Facebook page. We were really looking for high school students, but she realized she was not finding fulfillment in her career as a banker after 25 years. And she asked to sign up as a WisCaregiver career CDCP. We have many others in our experience too who are at midlife, who've been in retail, manufacturing. They want a new start where they can feel that meaningfulness that Hans was mentioning. And also in our target audience is the broad sense of community in the state of Wisconsin, the family members, the friends, anyone out there who knows of someone who has a very caring heart. We want them to know about WisCaregiver careers so they can share the message and get people to come to the website and consider a career in healthcare through free training. Another part of our launching of WisCaregiver careers, certified direct care professionals, is really thinking, okay, we're targeting audiences, but what are we really trying to say to them? What are our core messages? Why would anybody want to come and learn more about us? And we all met with our counterparts at DHS, Kevin's team, to define WisCaregiver careers. And one of the top elements on our list came through as the strength of trust, that the Wisconsin Department of Health Services is very credible, very respected, and that this is a strength. We're not some online for-profit educational entity. We're with the very renowned Department of Health Services. So we're trusted. And then also WisCaregiver careers is free. There's a lot of barriers we discovered in our CNA program to caring individuals who want to give back, who want to start a career, but it was $1,200, $1,500 to go to a private training class, if you will.
On a specific day.
Yeah, and it's hard with childcare and other commitments and other work to get the training. And this program, CDCP, is free and it's online. And there's another great incentive that we get to tell people about, and that is that individuals who complete their training can earn up to a $500 bonus, which really adds to our brand strength package. It's also important in the state of Wisconsin that WisCaregiver careers is accessible. And accessibility is seen in a number of different ways. One is geographic, frankly. We have 72 counties in Wisconsin, and we want everyone in Wisconsin to know they can partake in this program. So it's open to any caring individual, anywhere. And we also wanted our registrants to know that there are employers statewide, now over 1,000 of them, who are able to access our CDCPs and vice versa, so that there is a chance for employment, not just training, but a real WisCaregiver connections, which is our tagline and name for the program, to employers. So we'll train you, we'll help you find a job. We have participating employers also all over the state to give accessibility. And as Hans mentioned earlier, we also developed a whole part of our marketing campaign with language in mind. And the first is Spanish. And thanks to the partners at UW Green Bay who developed the curriculum is now available to people to take in the Spanish language. This is a big advancement. It was the CNAs and that recruitment. We often failed because there were caring hearts people would come from different countries, but the tests are all in English and they couldn't go through with the
Right.
final
So reduced our
training.
potential audience significantly.
It did. But this program, CDCP, now is available in Spanish. And in the future this year, we're also looking at the third most popular language in the state of Wisconsin. And that language is Hmong, with a totally different alphabet. And we're learning a lot about the Hmong language. Also, brand strength is the employment focus, which I mentioned before, and relevancy, that we can offer the credentials of a CDCP, but it goes forward to CNA training. It's coordinated so that the CDPC training equates to some of your start as CNA. Also, there are additional credentials. So you don't just get your certificate and it doesn't stop there. We can market, you get your beginning with CDCP, but then you can go on and get specialty training in things like dementia or wound care or other areas and use that to advance your employment opportunities.
CDCP specialist.
Exactly. Yeah. And the bigger view that we wanted to share of a brand strength is anyone who wants to work with people, they need to learn empathy, and they should start with certified direct care professional training, because if you're going to be good at anything, if you're going to be a dental hygienist or an administrator in healthcare or move up to be an RN and beyond, you need to understand people, and this is the place you should start. The brand identity, once we know what we are, it's easier to build on our logo. Kevin described how we now have 3 branches of our brand. We started with WisCaregiver Careers and added on to our logo in a subtle way, but we still have that strong WisCaregivers brand, its color and typography, and also the voice of how we talk to people, how we reach out to people in a way that isn't clinical and isn't too government oriented, but really more of a peer.
Overwhelming or scary. It's
appealing.
It's a helpful, appealing brand voice.
Right. And with that comes the core messages, which we've been talking to you about with the different brand strengths and so forth. In our view, once all these pieces are put together, it's kind of like, you know that you can open the restaurant. We know what the menu is. We know what the color is. We know what's going on there. But how are people going to find us? And they're going to find us through the website.
So the website is, we have this brand. We've created a there, in quotes, there. We're going to use advertising to tell people about where to go. So we need a there. And in this case, it's a website. And the website really is our virtual 24-hour-a-day, 365-day-a-year showroom or institute of becoming a CDCP. And so part of the brand is coming up with a website URL. And in this case, WisCaregiver CDCP fits into our house of brands. Some of the other websites are WisCaregiver.com and WisCaregiverCNA.com. The URL is on message, it's memorable, and it's really promotable. People remember it. It fits on a business card. It fits into little ads. So it works out great. The site content is easily readable on both mobile and desktop browsers. Now, this sounds kind of like, yeah, so what? But desktop browsers are great for laying something out. A lot of government websites are laid out for desktop browsers. But we know from analytics that the vast majority, it's like what, 90%?
Sometimes, yeah.
So, yeah, a very, very high percentage of people who are engaging with WisCaregiver, CDCP.com are doing it on a mobile device. And that may be the only device they have to search the internet, view the internet. So we have to make sure that our site performs on mobile as well. The site content informs and engages the site visitor because we can't possibly put all of the messaging about WisCaregiver CDCP into one single television commercial or one single print ad, but we need to inspire people to learn more at WisCaregiverCDCP.com, our website. Of course, the site content reinforces all the brand messaging so that when people arrive at the website, it's not a disconnect from what they may have learned about it through advertising or through friends or social media. There's no disconnect. All the brand, the colors, everything, the voice, the tone, the pictures are all what one would expect. Site content and site visits drive program registration. And that's really the business of what this whole brand and mission is of course, it's to put people into caregiving roles, but it also is we need to get them registered. So we need to have this giant funnel, this big funnel where we get a lot of people's attention, we get people to go to the website, and then people register. And by accomplishing that, we have a successful program. So this is a little illustration of our website, the front page for our website. And you can see how it looks on both a laptop, a desktop browser, as well as on mobile. You can see that the two versions of the website are very similar. And if someone hopped from one to the other, they wouldn't become lost or confused or have it look radically different. Of course, as you can see, you couldn't really fit the desktop layout into a mobile browser, especially a vertical mobile browser. We also expanded the brand recently to Spanish. And the way that we constructed and thought ahead of time about things allowed us to do this fairly easily. So I'm going to ask you to look at the screen and I'm going to press a button and you'll see a little change in the pictures, but not that much. I'm going to switch right now. And you can see that the two websites, the first one you saw was the English variant of WisCaregiverCDCP.com. This is the Spanish variant, WisCaregiverCDCP.com Bada Ese, which is the Spanish version of the website. By having a unique URL for Spanish language folks, we can promote it on Spanish language focused media, whether it's print, radio is quite common in Wisconsin to have Spanish only radio stations, and other areas on how we market to Spanish speaking populations. I'd like to next show you a little animated video that we created that kind of goes through the major points on why WisCaregiver Career CDCP is appealing. We did it in an animated style. We use both a live action and an animated style in our advertising to handle different kinds of messaging. So let's take a look.
Are you ready to start a meaningful career? People all across Wisconsin are enjoying the rewards and stability of a career in healthcare. Why not you? WisCaregiver Careers can help you get started as a certified direct care professional. The Wisconsin Department of Health Services, in partnership with the University of Wisconsin-Green Bay, created this free certification program to increase the number of caregivers in our state. The new Certified Direct Care Professional program will make it possible for thousands of caring people to start their careers in healthcare. All training is free and online. You'll learn at your own pace, and you'll be certified in under 40 hours. You'll then have the essential skills you need to make life better for older adults or people with a disability. Plus, you can earn up to $500 in bonuses. Certified direct care professionals are in high demand and have the credentials needed for many workplace opportunities. From home and community-based services to one-on-one care, adult family homes, and more. WisCaregiver Careers will connect you with work options across the state. Visit the WisCaregiver Careers Certified Direct Care Professional website to learn about the many benefits of becoming a CDCP. Sign up today and start receiving updates about the program. Be among the first to become a certified direct care professional. WisCaregiver Careers is a professional workforce advancement program of the Wisconsin Department of Health Services in partnership with the University of Wisconsin Green Bay. Visit our website at WisCaregiverCDCP.com.
We call that our how-to video for WisCaregiver Careers CDCP. There you saw in the animation and text on screen and the characters kind of the big story of the brand's strengths and the advantages of the program. It's a 2-minute piece that you just watched, which is really too long for basic advertising, but it's on the website to inform.
Perfect for social media.
And good for social media. But I'm going to move into more of our advertising and promotions, where often we have to be a little shorter in our messaging, but it's good to have the big picture to share. And now we're going to look at more of those crucial elements that are used to help us measure the outcomes of the advertising campaign based on the objectives that Hans and I introduced earlier. We are trying in all of our promotions, whether it is video, audio, or print, to increase awareness so that that big, broad Wisconsin community knows about WisCaregiver Careers. Always, we're trying to drive website traffic with a call to action. Through that website traffic, we generate registrations and capture people's information so that we can keep their journey with CDCP going. And we continue with variations to promote features. Not every TV spot can say it all, of course, but we mix it up to promote features, continue to educate the market, to build partnerships and alliances through our promotions. And that could be high school educators or employers. And overall, to enhance brand perception so that when people hear WisCaregiver Careers, an idea comes to mind. The advertising channels that we use take off from our website and go a little further. One of our goals was to reach the state of Wisconsin. That means a diverse audience all over the state, urban and rural. We use broadcast television, and in Wisconsin, that's about 45 stations that cover the breadth of the state, as well as broadcast radio, which is even greater in getting into smaller communities and communities all over the state. We have about 180 stations, including some Spanish only, both for radio and TV. Our strategies and channels go further, sort of complementing our health equity initiative for reaching all people in Wisconsin through broadcast media. We also do advertising in all print media. We do not forget the small community newspapers, the dailies and the weeklies, which are the lifeblood of many of our smaller, sparsely populated parts of Wisconsin. And with that, we have specialty print publications that are targeted to special audiences of Native Americans, urban, Black, or Hispanic speaking people. We also do general digital advertising for many of you like us. We get our news, our local news and state news on a digital platform. So we have banner ads and other ads along with the daily news. And then now and then there's some other specialty print editions that reach the state of Wisconsin or a special population that we're part of. That said, with our statewide coverage with health equity in mind, we really lean into digital media to reach the people who we think are most likely to be caregivers through their demographics, their behaviors, and the content of our messaging about the advantages of being a caregiver. We use digital display. These would be the ads that reach you and audiences when you're looking things up on your phone or on your desktop. Websites that are very broad that match the behaviors of a potential caregiver. We also use social media, which helps us on a number of platforms to reach people, to tell about the different kinds of advantages to CDCP. I think our best ever post was with the high school student that had more than 80 shares. We're very excited about that and realized, oh, a lot of parents really want their kids to get a start in healthcare or to try something before they go on in their schooling and discover they love it or they don't.
And the beautiful thing with social media is it's really easily shareable across a person's personal friends network.
That's right. It's always fun to see the shout outs to how it's shared to a relative. You know, you got to check out this program. We are using a tactic called geofencing as well. We also call that device ID. And it is a way to reach people in certain geographic zones where we think it might be likely to capture our audience of caregivers. And there are boundaries to how this can be done. For example, you cannot do high schools or anything like that, or medical facilities, but we do use our physical addresses of our employers, and
community centers,
things of that nature throughout the state of Wisconsin, where we think people might be going. And some of our past people, registrants who were interested in CNA, for example, we might see where they are and see, hey, here's a message about CDCP. And that's proven very effective for us. We also are looking to reach Spanish language individuals, and we've been using geofencing to think of where are the places where our Spanish speakers in the state are going. So we are geofencing around community centers and Spanish grocery stores and even Catholic churches in urban areas where we know there's a Spanish parish, exactly, or masses. One of our most responsive areas of digital media is called video pre-roll. And these are our 30-second or shorter ads or motion media that are delivered to people who are about to look at content that seems to fit the behavior of a caregiver. And it's a way for us to give more of an emotional appeal to our potential audience, to show them other caregivers at work. We're careful to have different kinds of people featured at different ages, ethnicities, rural and urban settings. So eventually people get to know WisCaregiver careers might be right for them. There's a caregiver like them in our advertisements. We mentioned earlier radio and our Spanish-speaking audience that we wish to reach, and we're using streaming audio as one of our more successful ways to target this audience. A lot of people have on their radio, their music, their podcasts from all walks of life throughout the day while they're working. And we see in our stats that it's equal between desktop and mobile phones, how people are streaming the audio. And it's not as measurable, perhaps, as other ads where we can count the clicks because people are listening. They're not clicking immediately to the website, but we know we're engaging them, and it's part of our outreach to get more people to WisCaregiver.com. Our last digital target that we wanted to talk to you today about is called search engine marketing, or SEM. And this is kind of the all-embracing funnel. Everything else that I've mentioned has built awareness for WisCaregiver careers, the website, to any press releases from the Department of Health Services. The buzzword is out there. And search engine marketing is when someone, oh yeah, I heard of that program. It was WisCaregiver, and it fills in. The Google search, the Bing search fills in WisCaregiver careers. We do both sponsored ads and we work with search engine optimization so that WisCaregiver careers comes up on the search. The digital ads, what do they look like? It's part of the brand that we take across all of our media. What you're seeing on screen now is a mix of print ads and digital ads. The print ads, we include a QR code, which allows us to track how we did in a certain print publication or promotion. The digital ads have buttons you might see that say, get started in English. And in parallel on the far right, we have the Spanish language ads. Those with buttons, again, help us track how many people looked at the ad, where that came from. We, in addition to this, also have print publications that keep the brand and the brand look all the way across, so that continues. The social media ads you're seeing here, or posts and ads, again, have a different look and appeal, trying to reach different kinds of people. We do motion media looks to get people's eye with messaging of video, and the high school student that did so well with shares. And then also our highest viewing is the image on the right. That is a video, our 30-second spot showing Cameron, a man, as a caregiver. And that did really well. This is just another look at some of the advertising assets of the digital campaign that also mixes different ethnicities. And we also use, again, our animated spots and our animated characters because they're different. They kind of shake up the audience. People see you in a new way, and we appeal to different people. We're always trying new things to get that attention.
Well, once we have all your branding thoughts together and we have all our advertising created and everything set to go, it's time to launch. And Kevin, our client, Kevin Coughlin, was, really, really key in this. And Kevin, I'm sure will have some interjections on this section. But for the launch, there's a couple of things that we really needed to look at, and that was soft launch, which is something we'd advise everybody doing when launching a campaign like this to the public. You have a soft launch, which is a limited release of the program. That's really to shake down all the technology behind things, make sure everything's working before you go out to the public and tell everybody that you exist. And soft launch usually is, sometimes it's a month, sometimes it's 2 weeks, sometimes it's a week before the hard launch, which is the actual launch to the public. And that requires advertising is all in place to start running to promote the program. The website is completely ready for visitors. And also the agency, in our case, the Wisconsin DHS, has had adequate time to prepare and place any kind of public relations they want to do, because this is a big undertaking for our client. Kevin, would you like to add anything?
Yeah, one of the things with what we were finding, we had a lot of little mini launches as well. And, sometimes when you have as big a project as this is, and, we have internal staff, we have external partners, you also want to make it fun. And we're from Wisconsin and we do cheese. So we had that early website launch, our soft launch, and some of the other things was our brie cheese soft launch. And then we went to the semi-soft launch where we actually reached out to some early interest people that wanted to become a CDCP, and we were able to test some of these people. We had some people beta test during our Gouda cheese or our semi-soft launch, and then we had the big launch, which was our Parmesan cheese, which was our hard launch with our press release. We had listserv announcements, the big marketing, paid marketing. And then later we had our manchego. I'm not probably pronouncing that correctly. It's a Mexican cheese for our Spanish launch. And then, we brought everybody together and we celebrated our success, because this was a big deal when we launched about a year ago. And then we went out, and of course we had a cheese board of all of our cheeses. So,
and it was enjoyed by all.
Yeah.
It was. So back to you.
Yeah. So we are going to show you two 30-second spots here. Both of them were used in multiple different media forms, broadcast, streaming, some of the different media channels Susan was talking about. This one's entitled Become a Certified Direct Care Professional.
Become a certified direct care professional for free.
Being a direct care provider is a great job. It's motivation to get up and come back because somebody's counting on me.
Direct care workers are essential. They help someone with a disability be seen as a neighbor.
I really wake up every day excited to go to work.
This is something that I'm very passionate about. I want to have a career in this.
Become a CDCP today for free. Sign up at WisCaregiverCDCP.com.
So as you can see, we wanted to have an emotional appeal, show what the job was like, show different situations, have sound bites from people who are living this life as a caregiver, and also show their interactions with the people who they're providing caregiving to. And of course, hit those big brand points of get free training and a $500 bonus and the URL for the program. The next spot is an animated spot, which delivers information about the program in only the way that an animated spot can.
Are you ready to start a meaningful career in healthcare? Are you looking for a job that fits your work-life balance? Become a certified direct care professional today and help those who need you most in your community. WisCaregiver Careers makes it easy with free online training and a $500 bonus. See your name on Wisconsin's CDCP registry. Start your career today at WisCaregiverCDCP.com.
Those videos give you a sense of the flavor of the different kinds of video ads. Earlier, I showed you some of the print and digital ads that also came together as part of this campaign. But we don't stop there. We're always looking at the campaign metrics and performance of everything. What is the right mix? Who clicked on what is part of our performance evaluation. Then we do optimization. Okay, this ad did better in this digital media versus that. How does that play out? We look at the budget, and if we need more budget in a certain area because it's really doing well, we make that allocation. And then always we're working with Kevin on the alignment of the objectives. If we're going to go Spanish, we had to change our alignment. We didn't know at first we were going to be moving ahead in Spanish, so we definitely didn't want to miss that opportunity and went with it. And we're always just looking for continuous improvement on how we can do better and freshening our messages so that people are not bored with the message, that we always have new content, new videos. Lastly, we measure with real feedback on a lot of our advertising. Some things, that people on radio or television, we don't know exactly how many became aware of the brand, or even some newspaper print pieces. But we do know with digital media, we can see, how did all these different channels work together? And we could see that we had over 65,700 clicks to the website that drove traffic, and that those people who came to the website looked at a couple pages, 18,000, almost 18,500.
And some of them registered.
And that's coming next. We know from the social media how many people saw the ad or the post and they clicked to the website. We can see our website views and see, well, how many different people came to the website, how many in total, more than 250,000, and then how many looked around on the website for more than 30 seconds and went to a couple of pages. Well, that was close to 42,000, not quite. All in all, we have a lot of registrations, over 8,300 CDCP registrations to date. And I want to add that our partner at UW Green Bay is also looking at the demographics of those registrations. So there are numbers on ethnicity and geography, so that we know we're really touching people all over the state from all backgrounds, urban and rural and Spanish speaking, and soon Hmong speakers.
Kevin, you want to take it home?
So we brought a lot of information to you today, and I think the message is it's so important to have the marketing piece of the program. And I think we were somewhat lucky because we had a funding source when we first started, and it was successful. We had back in the CNA program, the marketing was so successful we had to shut down our registration because we had too many people with the training slots we have. And one of the lessons we learned is really with this online training, we're not going to run into those training bottleneck issues. So it did help us as we moved on and did other parts of the project, because another important message is have metrics as well, because you want to be able to prove the point that the investment in marketing and creating this brand is worth that investment. So with that, I think we wanted to turn it back to Jordana, if you have some questions or questions of the audience.
Thank you so much, Kevin, Susan, Hans. That was extraordinary. I know I had heard a lot of it in our prep sessions, and I learned so much more here, and I really enjoyed it. I hope everyone else did as well. So I want to remind everyone, if you have questions for any of the panelists, please submit it in the Q&A. I know we have a couple, and we've been able to answer a couple of them, and hopefully we'll get some more as well. I'll start with a question, Kevin, for you, which to some degree I think is the elephant in the room, which is, how did you pay for all this? So you need a lot of resources to build something as extraordinary as what was just presented to us. And if you can, talk more about than just money, but what kind of sort of systemic support did you get? And also, how does a campaign like this survive a pandemic? How does it survive several political administrations, et cetera?
Yeah, well, I think first of all, workforce is, everybody is having a struggle with it. So, again, 27 years of public service, a lot of times I go to a group of advocates or individuals, and they're not happy with the state and what we're doing, but this has been, it's like a love fest. Everybody is happy that we're doing something, and we're doing it successfully because our data is showing that. So I think all states out there, you have an opportunity that I think both sides of the aisle has constituents that are struggling with this issue. And we've had, what has helped our state also is we have a governor that has had a couple of his early administrative, he created a caregiver task force, and now he has a new healthcare task force. So he has been very focused on it. So that has helped us gain other attention. As you saw in our videos, we had our Medicaid director, our my supervisor, we had the chancellor from the university all talking about the importance of this program. So those kinds of things really garner a lot of support. And again, I think when opportunity knocks, we have had, I think we're on our 7th type of funding stream. So we used civil money penalty funds for nursing homes. We used our Department of Labor has like a fast forward grant that had workforce for underemployed individuals. We did that, and then when Monday Follows the Person came along and ARPA HCBS, we jumped on that, and everybody, all of the other collaborators and advocates, they all wanted us to do this work because it was so important. So I think that's it. And we were able to, on each one of these, include a marketing budget, because we could go back and say, back in 2017, we had to turn off our registrations because our marketing was so good.
Wow. I'm actually going to skip over to one of the questions that an audience member has asked us, because it's sort of a great follow-up here. And it's about what percentage of program funding was allocated to marketing, if we know something that specific.
Yeah, well, that's a good question. I'm trying to think back. I think it was about between 10 and 20% early on. It kind of depends. You're going to have a little more marketing cost on the front end because you're trying to build your assets. So there's that the building of video and all of that costs money, and then you have the paid advertising. So, I think we're going to be in a place as we're moving forward where that percentage is going to be less, because, a lot of it's already been created, and we'll be mostly focused on, managing the website. And again, that's so important that stays, with the people that can do that well, and our paid advertising.
Great. Thank you. So you all talked about not just a media campaign here, right? You talked about $500 bonuses. You talked about free online training. How important is it to integrate a marketing campaign like the one you presented with these other types of initiatives that you're working on, with education and certification?
Well, I'll start, but it's everything. And let me repeat, it is everything. You have to have it. We could have the best training program, and we're hearing that it's a really good program where we survey our CDCPs as they come out of the training, and all of them are overwhelmingly saying they like this training. But if we didn't have the marketing to drive them to our website to say, yes, I want to do that, or they got that message of, yeah, I want to be a caregiver, it tugged at my heartstrings, they wouldn't have taken this great training. So, I mean, you just have to have it. And I think, again, state agencies, typically we don't think about that as much. And we do these great programs, but we don't have that other piece that's missing to get people to be interested in what we're doing.
Hans and Susan, anything you'd add on
Yeah.
that?
Yeah, I think the other thing is that we're making, I mean, not only as Kevin said, you have to have a great program, but you're also asking people to change their career, change their job, to enter a completely different track. And so where are those people? They're everywhere. And so we need to advertise very broadly with simple messages that are of which the questions are fulfilled on the website. But we have to be, we not only talked about the regional and diversity within our state between urban centers and very rural counties. Those people are everywhere, and they're coming from all different kinds of other jobs like fast food and concrete, things like that, construction.
If I could just add to, talking about that, everywhere. I have a colleague that lives in our northern Wisconsin, and people are familiar with northern Wisconsin. It's very rural, very rustic area, and she's from a small town. And she contacted me one day and said, "Hey, I saw your TV commercial on TV, and then I got our weekly newspaper, and you had an ad in there." And I think that's where don't forget about those kind of types of advertising. They're a little harder to find, but there's still a lot of bang in your buck for that type of advertising.
That's a great story. Can you all speak a little bit about how you engaged folks with lived experience in the work, in the creation of the campaign or other elements?
Yeah, so a lot of our awareness we reached a lot of people with our listening session because we wanted to make sure that we had the right, because we were developing a curriculum as well. So one of the groups was also our councils and board members, and a lot of people with lived experience are on those boards and councils. So we talked to them a lot, and then also our self-directed program, where we wanted to make sure that them as an employer were part of this program, that it's essential to be able to find caregivers. So we talked to them, and we had them actually beta test our WisCaregiver connections to make sure that they could navigate that system and be able to find caregivers. And then again, we keep updating those groups about where we're at in the process and getting constant feedback. So it's a critical group for us. And we also understand we need to do more support and offer more resources for some of our people who are self-directing their care. And we've done that in this project.
Susan, Hans, anything you want to add?
Yeah, I have a little extra take on that. And Kevin, you really helped us talk to different employers, and those employers helped us talk to other employers and other direct care workers and professionals. So the whole campaign really began for us by videotaping our interviews with different people and the true story of what it's like to be a caregiver and to be an employer, and the challenges were all told in the words of the people advising us and probably the Department of Health Services. And I think that was integral to having a true campaign that resonated with people, because it was real. It's really what people said and how they felt and what they shared.
Nothing was scripted. Those are all organic sound bites of people speaking from their heart.
Great, thank you. Last question for me before we move on. Thank you so much. We've got a number of questions in the Q&A. You guys put up some really impressive stats at the end there about how you've demonstrated success. And some of that was, click to website engagement, engagement on the sign up page. I just wanted to give you a moment to talk about any other kinds of metrics of success that you have for this program, or sort of how you know that you got this job done, or what's been working for you.
Well, I mean, our big number is registrations. That's their job. And then part of our job is getting them from registration through the program and getting them on our registry, and then getting them connected to our employer, and then getting them to a retention. And we're monitoring all of that. We have kind of our pipeline right now. I think as of yesterday or today, actually, every Thursday I get new data, and we're over 8,500 registrants, and they're all at different places in that process. And we have over almost 600 that are on our registry, and another 100 plus that are ready to take the test. It's 4 different days to take the test, and then I forget the number that have met our 6-month retention. And then we also have a third-party evaluation by the University of Wisconsin-Milwaukee. So they're going to be doing a qualitative and quantitative analysis of our program. And that's what we're hoping, a third-party, research entity really looking at this program to see what's working, what's not. And what we hope to do then is to take all of this information forward as we ask for a biennial budget request after the American Rescue Plan Act funding is over, so that we can continue this program. And then we also do, I talked about, we survey every one of our people that have completed the training, and we're hearing good things about that. So I think we're going to have a lot of data to kind of tell our story and to hopefully keep this project going.
Great. One of the related questions we have in the chat is, do you maintain a DCW registry?
Yes, we do. And we have a new project. Hans talked a little bit about it, our micro credentials. So we are working with other training partners that might have great training out there, so that people can upskill their current training and get more specialized in certain areas. All of that goes onto the registry as well. So when we have our WisCaregiver Connections, which is our platform that connects our job seekers and our employers, they can see everything that's on that registry, as well as those individuals get virtual badges for all of their training. And one of the things I'm, I think, most proud of in our listening sessions, we heard from direct care workers that, they weren't getting recognized. They weren't being appreciated. They didn't have a title. They were all called all kinds of different things. They weren't like a CNA who's on a registry, has a title, took a test. And I think that's what we brought to them. They were the ones that voted on our name, certified direct care professional. They wanted to be viewed as professionals, which they are because of the critical work that they do. So I think having all of that has really enhanced their stature and their status in this really important work that we're trying to do.
Susan and Hans, anything else you want to add there?
Well, I think Kevin really hit it. I mean, I think really one of the branding appeals is dignity. It's dignity for the individual who's getting care, and the care provider. That's part of the reframing and elevating their profession is having things that show that they're a dignified member of society. I mean, I'm talking to the choir here, but this is a strategic issue for our country, and we need to elevate this. And being part of, having a dignified way and people being recognized for their achievement is really an important appeal to getting people to see this as a career.
We also had to stand up for it, as I recall. One of the reviewers of many reviewers of all the content that we've shared today was, why are you putting this registry thing on? Who cares about that? And we had to say it's one of the key elements
Right.
of everybody we spoke with.
Yeah.
We have to have the registry
Yeah.
in our advertisement.
Yeah, and broadly within our demographic, achievement and accreditation for the target demographic is a really big thing. And can't be underestimated, I don't
Right.
think.
And the chancellor of UW Green Bay, way back in that first video we shared, he said the importance of credentialing and education, and people can take their credentials with them and they take it on their career pathway.
We have a couple of technical questions in the Q&A that I want to run through for you. The first is the training live or recorded? Is it interactive?
So it is a recorded video, so it's on demand whenever people want to take the class. But they're not just on their own. There's certain parts of the session that they have to do reflections on, certain things to kind of advance to the next area. And then our University of Wisconsin Green Bay kind of watches that. Sometimes they intercede and they say, yeah, you're not quite, I think you're off a little bit on the concepts, please, take this over, or here's some additional resources. And then it's a proctored exam, live, but it's proctored, it's not recorded. A person is kind of virtually in the room with you to take that test.
Thank you. And the second technical question is the website technically a state-owned and managed site, or is that contracted out?
So it's the property of the Department of Health Services. So we, through our contract with Pigorsch Media, who helps manage that for us. And then University of Wisconsin Green Bay, we have an interagency agreement because they're a public entity. It's a public university. They also have part of that. The curriculum and everything is on their websites. So that is a partnership that we have with University of Wisconsin Green Bay.
Thank you. And Christine from Washington, I know there's been a little back and forth in the chat, but I want to get you a little more information, is asking if you all can speak a little bit more about how you created the Spanish language version of the website as separate for targeted marketing.
Hans and Susie, do you want to take that one?
Sure. We had really great, vetted by professionals on client side, and it had been out for, I don't know, 6-7 months or so, the English version of the website. We knew the Spanish initiative was coming up. We, through our client, Wisconsin Department of Health Services, they have interpreters who translated the website. And the way really inside baseball here, the way we managed it is we had 2 versions of the website, one in English with all the pages and one that would be in Spanish. So all the translation was filled in based upon the English equivalent. Some of our team speak Spanish. Some of our team, like me, speak a little Spanish and a lot more Italian, but we could follow along and pretty easily with the structure that we set up. And so we built the original English language website with the concept of how would this work in Spanish, just broadly. And then when we built the Spanish website, we already had figured out a lot of interactions and things like that. And basically it's almost a mirror of the English site. There's a few things that we changed that were just due to line length and things like that for the Spanish site.
And also we really searched for imagery that would be more fitting for a Spanish audience, Spanish language audience. So that also switched up on the ES site.
And diverse images within the multiple Spanish cultures that we get to enjoy in our state.
Right.
And then on the other side, we have all of the curriculum part of it that then was also translated into Spanish, so that the person had the full experience. They may have heard a advertising in Spanish. They went to our Spanish website. They clicked register now. It took them to the registration page, which was in Spanish. They signed up. They got an email from UW Green Bay. welcome. Here's how you set up your account and start taking the class. And they took the class in Spanish, and then they took the test in Spanish. So it was a full experience. And then we're tracking this group too. We know who's taking that and kind of who's in the pipeline, and our evaluation is also going to talk to those individuals to see, was it worth, did it make a difference that this was in your native language as opposed to English?
Great, Christine, we hope that helps. The last question in the Q&A, and it's your last chance if you want to add some more questions, we're happy to pose them to our panelists, is when did the campaign launch? And I'll add to it, just in case it's our last question, any plans for the future for what this campaign looks like in the next couple of years?
Well, the launch was just a little over a year ago. And I guess which launch? The Brie launch or the Parmesan launch? But Parmesan went off, I think it was last week of July. So it's just a year old. So, and I think we've got, we're looking at a lot more interest in year two, because we built a lot of infrastructure, especially with the high schools. We have lesson plans for schools to set up their training as like a semester long class or extra credit. There's a lot of enthusiasm. If you haven't worked with HOSA in your state, almost every state has a HOSA, HOSA chapter. These are high school kids that are interested in a healthcare career. Susan and Hans have done a lot of work with them on sponsoring their events, and it's been a really good relationship. And I just lost track of where I was going.
Oh, we got a list.
Okay.
Kevin's given us the list, but next steps, building on with the student and the HOSA, are some terrific new incentives that the Department of Health Services, Kevin, was able to put together, which includes a referral bonus. So if you do have your CDCP certification and you get a friend to register, there's a spot where you can have your friend list your name and you get a $250 bonus, which is not limited. You can have a lot of friends, which is a great way to grow the program. And then also for the high school students, there is a bonus to the school of the instructor. So the few teachers that we've met recently, they're thinking of offering it as part of their health science curriculum. And if they have 10 students sign up and put their names, their school gets $250 per student, which could make a huge difference in a school district. So we're hoping that organically gets more and more young people to register, because it's great for them and their future, but also great for the school and health sciences.
And these high school students, they are who are involved in HOSA. Almost all of them have aspirations to go on to college, university, probably into post-university, maybe wanting to become a professional in the healthcare field. So having a job like being a CDCP is a great beginning stepping stone for these brilliant, oftentimes everyone we've talked to has been really smart and very caring. And this is a great stepping stone for them to see, am I cut out to be in the clinical side? Am I cut out to be an RN or a therapist of some kind or a doctor? And sometimes they find out they are. Sometimes they find out, I think I'm going to be in the more academic or research side. It also looks great on their college resume. It looks great on their resume to get into programs if they're in college. So we've found that a lot of the young people who are joining through our HOSA and our youth initiative are just really great caregivers because they're eager, they're smart, and they're kind.
Yeah. So we'll have new social media featuring the students, and then we hope to track them as they are employed and have success stories. And then the other area we mentioned earlier was also the Hmong version of the website and how we can create the content in Hmong, companion content. Kevin, anything else that you can think of on that big platter of yours?
Yeah, sorry, I got kicked out for just a second, so I'm back. Yeah, I think just the future, our future is we want to get a biennial budget approved so this really good work can continue. The other thing that is so nice about the versatility of our kind of the platform and the infrastructure that we've created, we are looking at, some gaps. Like so we have managed care in our state, and providers are struggling with mental health, and people with intellectual and developmental disability. There's not a lot of training out there. So we're looking at, with our partnership with the University of Wisconsin Green Bay and all of our other partnerships, we're going to create some curriculum for that group, and then we can connect them to the managed care organizations and their provider network, and make sure that we have staff that are able to do that kind of training. It'll fall under our micro credential, and we're probably going to be needing some creative assets to help market that, to make sure that people are aware of some of these other training opportunities. So there's just a lot of flexibility that we have. And the big part is it's the Big Tent coming up in the biennial budget, and right now is we have both our CNA and our CDCP under one big umbrella. So it's never been easier to launch your healthcare career. So we're excited about kind of having that combination campaign because both of those programs need staff and resources.
Well, I can't thank you all enough for sharing the story of WisCaregivers. Before I turn it back over to Stephanie for a closing, just a couple of themes that really struck me today. The first was the way you all were able to make such an emotional appeal through the work. It's clearly not lucky. It's clearly so thoughtful, careful, almost a calculated piece of work to draw in new audiences, using a diversity of Wisconsinites in a diversity of environments so people can really see themselves. I think the second thing I'm really going to take away is the tremendous versioning you've done, for lack of a better word. Some of that versioning, I think, was for medium, TV, radio, print, digital, social media, even thinking about animated spots in addition to real life anecdotes, or some of it was in different languages, the Spanish language work you've done, the future Hmong work that you're going to do. And then, of course, I learned the new term geofencing to focus on a specific area, like a Spanish grocery store or a particular church. It's just a remarkably comprehensive effort. It's also clear how important it is that this isn't just a media campaign. There's free online training, there's a $500 bonus, a potential certification. As you said, Hans, there has to be a real there once you've been pulled in by the media, and that's so clear here. Of course, the final obvious piece is the brilliant incorporation of cheese in the work, especially because it's afternoon snack time out here on the East Coast. It's making me hungry, but I would certainly expect nothing less out of Wisconsin. So thank you all again. Stephanie Gibbs, we will send it back to you for a closing.
Great. Thank you so much, Jordana. What a great discussion today. Thank you to our presenters, Kevin, Susan, and Hans. We really appreciate you sharing these insightful learnings from your experience with our PLC and ITA states. So I especially appreciated your efforts to reach diverse communities and age groups and engage the voice of those with lived experience to inform the approach as well. I was also intrigued by the cheese scale for the various launches. It sounds like you had a really good time implementing this great work, which is also very important. And also, we appreciate you, Jordana, for skillfully leading us through today's discussion. We would also like to recognize the Strategy Center funders and our partners, the Administration for Community Living. We thank them for joining us today. And lastly, to our states, thank you for tuning in. We hope that each of you gained valuable information to enhance your own state goals. So with that, our webinar is concluded, and I hope everyone has a good afternoon.